Suyash for this live, and we're just one day late. This was supposed to be a Children's Day live, but nonetheless, the health aspect of children is something that can be discussed any day. So the topic for today is nutrition for newborns, and it's a Children's Day special live. And so my name is Ria Jain, and I'm the head of iThrive Academy. And today we have Suyash Bhandari with us. Suyash, can you please introduce yourself?
Sure. Hello, everyone. Thank you, Ria, so much for a warm welcome. I am Suyash Bhandari. I am heading supplements vertical at iThrive. I am also uh, playing role in a lot of client coaching and like I am majorly joined as a functional nutritionist, but now I evolved into of course developing a lot of formulation supplements around that. So and I'm again a new parent as well. So yeah, a lot of experience. I'll try to dig deep from my learnings as well here today. I'll love to discuss. I think that's
Yeah,
what.
so today's live is going to be a lot of practical and theory giveaway, and a lot of takeaways from today's live for all our viewers and audience here, because Suyash, as he mentioned, is a new parent. His daughter is going to turn one, and there are a lot of things that he has to share while we go along. So nutrition for newborns. So Suyash, I think I would want to start with first emphasizing this point that we are going to, mainly focus on nutrition and healthy habits for children under the age of one, or up until the age of one, that is 0 to 1 year, and what needs to be done and what all comes with as the child ages, I mean
Goes.
month
Yeah.
by month, until he is one, until he or she is one. So there are a lot of changes that come along, and what those can impact your baby's health, and what can you do as a parent, for the viewers that are watching, what can you do as a parent to help your kid, or help yourself to avoid that situation, or what can you do in that situation if you already know some of these points that we are going to discuss today. So to start with, of course, when it's nutrition for newborns, the first thing that a newborn, when he comes to the world, when he's birthed, right? So 0 to 6 months, we all know that it's a period of exclusive breastfeeding, right? No matter what, there would be some problems in latching, and there could be problems, but a new mother should not give up, is what I've heard, and is what I am going to do, because I am a expectant mother now. So 0 to 6 months is the period of exclusive breastfeeding. And so we've all heard about exclusive breastfeeding. No, there's no need to introduce anything else. We've also heard people talk about giving water and other stuff, like taking care of the baby's digestive health, and things like that. But then that's really not required, because mother's milk is what is sufficient for the baby, and it's there to take care of each and everything that people think would the other things would suffice. So I would just want to now put some light on why breastfeeding is important. We've all heard about, yes, breastfeeding is important, but have we ever like read about why is it important? So breastfeeding is important because the breast milk itself, it contains it is actually a wonderful creation, I would say. It's actually called as white blood. It is also referred to as white blood, and there are a couple of reasons behind it. So if you see, in the breast milk ducts only, there are these fat membranes that are formed, and when the baby sucks on this milk, these membranes, they enter the baby's body, and these membranes, they actually help the baby make his cell membranes also. So cell is the ultimate unit of life. It's the functional unit of our survival. So cell membrane would again be an important aspect. So breast milk first helps you with that. It contains a lot of antibodies to help your baby fight against infections, right? and it contains certain enzymes, like one that comes on the top of my mind is lactoferrin, which binds all the free iron that might be there in your baby's body, again protecting him from the pathogens that are likely to make your baby fall prey to infections. There are these vital proteins and enzymes that are present in breast milk, again, that helps in the absorption of the important nutrients, both fat soluble and other nutrients in the baby's body. So this is how breast milk actually helps, and this is why a baby should be exclusively breastfed up until the age of 6 months. Okay. So Suyesh, do you have something to share about, for someone who is not able to produce any breast milk at all, any substitute for breast milk?
So yeah, first of all, as you discussed, so many advantages and so many important benefits of breast milk, right? It is not less than a superfood for sure for a small infant there, who is just entered into this world. Now, let's say if there are some complications, of the mother's going through, and for some or the other reason, the breast milk is not being enough produced, right? In that case, the best substitute for the baby will be the whole raw A2 milk, or the milk which was produced by old traditional cows, which were perfectly uh, grazed and free range and grass fed pasture cows. That's the best like substitute. Of course, it's not the best in terms of composition, because there's no comparison between a human milk and the cow's milk. Human milk is always will be the best food for the baby. But in cases where the baby is not able to drink that, or the baby doesn't get that, definitely this can act as substitute. Though there are a lot of other homemade formulas and commercial based formulas, which we would not dig deep right now at the moment, because again it requires a lot of technical expertise and a lot of measurements, a lot of quantities, and there can be some kind of contamination as well, which can prove lethal, right? So it cannot be done without the guidance of a expertise, right? So it's
Right.
best,
And it is something that is, would take time and, discussion in itself. So I've also
exactly.
heard, Suyash, that, there are some ways a mother can make her milk nutritious, more nutritious. It's already nutritious, but there are certain
Right.
nutrients that can help, make the mother's milk nutritious so that the nutrients can enter the baby's body. Any thoughts on that?
Yeah, so as we all know, whatever the mother will be eating will pass on, those nutrients will pass on through breast milk to the baby, right? So now, what the mother has to focus on is enhancing the nutrient quality. I have seen a lot of times, in my career, a lot of pregnant females, especially post-partum pregnant females, comes to me that they are worried about their post-partum belly fat and they want to lose weight, right? And I especially tell them before, right now is not the focus to you to lose your fat or weight. Your focus should be to get as much as nutrients from food, not cutting on it, not restricting calorie, but getting nutrient dense food to make sure that your breast milk, your milk is properly nourished. So there are really some great nutrients which one needs to keep in mind. First of all, let's start with fat soluble nutrients, like vitamins A, D, E, and K. Very very important in babies development. We all know that babies brain development, babies immune system development,
Yes.
and most importantly, if you see all the omega 3s, right, the DHA and the EPA content, right, it's very very important for the development of brain for the baby, right? And there are a lot of researches which have shown how well the IQ of the baby has been on higher side when they fed certain amount of DHA to child, right? So getting all those nutrients through themselves, and again getting that into the milk, it's very very important. Apart from that, omega 3s and fat soluble vitamins, apart from that, there is like lots of fats, right? Free range grass fed cows butter, ghee, or coconut oil, because that will help to enhance the density of the milk itself. It will help to increase the fat content of the milk, and in that, like that itself will only help the baby to give enough fats, because baby uh, the newborn baby requires a lot of different fats to develop their hormones, their brain, another thing, right? So it's
I
very
think
important to.
a really important point that you've raised up is the inclusion of saturated fat.
Yes.
So I had also read somewhere that it helps the the breast milk that is not coming out properly, or if there are if there is some problem with the nipple area, right, while breastfeeding, if the
Right.
mother at that point is including a lot of saturated fat, it is actually going to help with that also.
Ah, cool. That's
Yeah,
interesting stuff.
so that is another added advantage of adding saturated fats
Yeah,
in mother's diet. So again, so
and
breastfeeding in itself is important, and mother's diet during while she is breastfeeding is really really important, not just for the to give for nutritious milk for the baby, but for her own self also, because she will
definitely.
require those nutrients herself, because she'll be that in that postpartum phase where she'll require a lot of strength to help to handle the baby. It's going to be a new phase altogether,
Yes. So
right? And then,
adding certain
yes,
superfoods, like eggs, with egg yolks, is really great way to enhance their diet. Adding organ meats with liver, or adding bone broth. And now, if someone cannot eat all the non-vegetarian stuff, and someone is only eating vegetarian or vegan stuff, it will be slightly hard, to get all the nutrients. But of course, with the help of a good diet, along with supplements, again they can achieve that level. So
absolutely.
for that, mom, we need to do a lot of sprouted lentils or legumes in the diet, with good enough organic fresh fruits and
Hmm.
vegetables. That will really really help. And when we talk about certain supplements, right, there are, of course, as you know, you must also be taking certain supplements
Yes,
during your pregnancy period, right? It's very very important. The reason being, uh, we, like, in general, supplements are very very important because we don't get all the essential nutrients from the food, the diet itself, like considering the amount of environmental toxins, stress,
correct.
around us, and of course depleted soil health, lot of like inorganic, insecticide, pesticide rich soils have depleted all the soil health. So again, all those stuff definitely has uh, a lot of nutrient deficiencies. And again, a good, like, supplements which one can include will be ideally a good quality prenatal multivitamins, or a krill oil for omega 3s, especially if someone is not eating enough seafood for that,
Absolutely.
right? And also, one of the nutrient I would like to mention here is, like, I used to give this to Nilisha, because uh, vitamin K. Okay, so I used to give vitamin K supplement. The reason being, uh, the uh, the like, when the fetus is being developed, there is a high, a requirement of vitamin K at least at the third trimester of the pregnancy. So
Okay.
what, that's the reason I think, whenever the child is born, the doctors give vitamin K injection immediately to the infant, because they want to prevent any kind of hemorrhagic episode, or any kind
Right.
of
Hemorrhages.
I just, yeah, exactly. So what I gave, just to avoid that, I give vitamin K supplement, to Nisha, just to make sure that the baby has enough vitamin K supply in itself in her body, that she can be like fine even without an
So
injection as
this
well.
was in additional to what was included in her
Yes,
prenatals.
yes. So ideally, like, I included around 1 gram of vitamin K, like, almost on everyday basis, so that give enough vitamin K to her as well. And again, but if you are someone who can include organ meats and a lot of other things, then definitely you'll get all those from that as well, and you
Important
get
fat
your.
soluble, yeah,
Yeah, exactly. If
vitamin.
you, the more fats you include, the more fat soluble vitamins you get, the more you enhance that. And another important thing is your probiotics and vitamin D3, right?
Yeah,
It's very very important because uh, you should have a good gut microbiome, to so that you can pass on to your baby, right? So
yes.
that definitely impacts a lot. And
That
then vitamin D, we all know, right? We don't get it through enough sun. So then again, it's very important to get vitamin D through that as well.
that's
Yes, Ria, you were saying
actually,
something.
yeah,
Yeah.
one of the again advantages which just occurred to me of breast milk, that if a mother's microbiome is good, she may also pass it in the form of breast milk to the baby.
Yeah,
So you have to, a mother has to take care of her gut health despite of anything, because we usually, so there's this connection between, again, a child's gut health being good right from the birth via the method the baby was delivered. So vaginal delivery has very, very big advantage here, that if a baby is vaginally
totally.
delivered, all the good microbes are going to pass, will be passed on to the baby, and there'll be good establishment of the microbiome in the gut. While a c-section, a baby born via
Yeah,
c-section, is at a loss there, not at a complete loss. There are again various ways you can, the baby can
enhance.
be helped with the
Right.
establishment, re-establishment of the gut microbiome. But again, c-section delivery is, there's a disadvantage here, that the baby might lose on the important, microbes passed on to the baby via, the vaginal fluid. So, there are certain ways which can help the baby, born via c-section, to improve the gut health of this baby. So, Swish, I had heard that probiotics strains,
Yeah.
there are certain probiotic strains which can be, given to the baby, it's while he or she is breastfed, to, help to maintain or to help with a good gut health in the baby. So any thoughts there?
Yeah, definitely. Yeah, that's a very good point. Brought up in the discussion. So I would just like to modify slightly and add on to your points here as well. Like before going to the strange part, that not only C-section, like not only the like baby born through via C-section should be given probiotics. If let's say, so there are four conditions where I always see that if the person or if the mom has been gone through that I'll be adding probiotics in baby's health. First of all, one is if the baby is born via c-section. Second is if there are any kind of antibiotics which were given during pregnancy, delivery, or while nursing to your baby, because
Right.
that's very important, right? Any kind of antibiotics will destroy your gut
Going
microbiome.
to directly destroy the
Yeah,
microbe.
and then the third condition is if the mom has any kind of history of yeast infection before or during pregnancy, right? Because candida and yeast infection definitely disturbs your whole gut microbiome, and that's where probiotics are really, really helpful. And the fourth is if your baby has any kind of thrush or a yeast diaper rash, okay,
Yes.
like if they have those conditions, right? So in that scenarios, probiotics is definitely we need to include for babies good health. So there are two important strains which you need to look in your baby's probiotic. One is your bifidobacterium infantis, and second is lactobacillus acidophilus. Okay, so these two
Okay.
are very, very important strains which needs to be present, and which is generally passed on by from mom to a baby, right? So it's very important, you need to seek out for those strains whenever you're looking or choosing for a good probiotic. And ideally you need to start with at least 3 billion cfu per day to 5 billion, not more than that. So again, that's another dosage part which you need to look for. So yeah, that is something which you need to really consider when you're looking for probiotic as well. And
Exactly.
then
And
besides that, cod liver oil and vitamin D are two another important supplements which you need to add on to your baby's routine, because your cod liver will give omega 3s with vitamin A and D. And cod liver oil you can also get it fermented or through liquid form, so it's easy to fed to your baby,
yes,
right? And vitamin D, again, it's very, very important. If you as a mother are not having enough vitamin D, it's always at a risk that baby being deficient towards that. So adding a vitamin D, a good vitamin D with the drop form around 400 IU per day will really, really help and beneficial.
that's actually a new learning and a takeaway for myself, that these two strains would really help the baby with his or her gut health, maintenance of his or her gut health. And I would like to now talk about, in continuation to the same point of importance of gut microbiome and gut health. There are certain symptoms that your baby would show you if his or her gut is not good, or there are digestive disturbances. So that's in the form of colic pain or colic cry, which is what we call as colic pain or colic cry. So it's usually seen as a cry. So if your baby is crying for more than 2 hours or 3 hours straight, it is usually because of abdominal pain, gastric disturbances, which your baby of course would not be able to communicate. But this is the sign, and this is usually referred to as colic pain. It's not a normal sign; it's a sign of a digestive disturbance in a baby. So there are again certain points to be looked into here when looking at, or if you are someone who is seeing these symptoms on a daily basis. So again, this is a sign that your baby's digestion or digest act is disturbed. So there are certain that you can help your baby if your baby is suffering from colic pain. So there's usually zinc deficiency that leads to colic pain or colic cry. So you can help, or if a mother is deficient, mother's milk is not providing enough zinc, you can add a good amount of zinc there. If a mother is eating a lot of processed foods, again coming back to mother's nutrition here again, if the mother here is has eaten something that was gassy, or that was processed, and that included gluten or dairy that was pasteurized, and or vegetable or seed oils, or these foods that we generally ask a person to avoid. If the mother has eaten those foods, or she she did eat these processed foods, so these can also cause directly digestive disturbances in a baby. So in this case, a mother can incorporate probiotic rich foods and fermented foods in her diet, along with the probiotic strains that Suyash just mentioned. These can be added if a child is suffering from colic pain. These two strains especially should be looked out for and should be added in a baby's routine, along with breastfeeding. So that's about colic pain. And again, it's a good confirm I would say identifying marker of digestive disturbances in babies. So that's about
Because sometimes, like when I like earlier, earlier when I was learning parenting, I didn't know, why Nitisha like certainly sometimes, crying for no reason, right? So then I was, researching slightly a bit, so that could be a possibility, that could be because of any kind of discomfort with the child is suffering. Now, thanks to,
definitely.
of course, Nilisha and like her mom, because of their experience, they know, okay, okay, it could be because of the child is having any kind of digestive issues, or bloating or something like that. So again, experience definitely comes handy. But if you know this, if you have a cue of this, definitely it will be really really handy when you're dealing for like Nitisha.
Absolutely true. It
Yeah.
comes with experience, and I'm really thankful that you are also helping me with understanding these different cues, and what can go wrong or what might have gone wrong with the baby's routine or my routine. And this live itself is a learning for me, and I'm sure the viewers here also have a lot of takeaways today. So talking about another phase again, which is a very crucial part of the 0 to 1 year phase, which is teething. So a lot of children, they become cranky. These infants, they become cranky while the teething phase is nearing, and they just want to chew on foods, and they cry. And so what can be done to smooth out this teething phase also? So there are again two nutrients in particular that you need to make sure that the child is not deficient in and is getting enough of them, is iron and calcium. So that would again be after the weaning phase, right? So something on weaning, Suyash, that you would want to add?
Yeah, so definitely those two important nutrients. If you go to any pediatrician, they will also focus on. Most of the pediatricians, what they will do is they might not tell you, what kind of foods will help you to get that. They might just give you a,
Medicine.
over the counter supplement. Okay, okay, you can, give this calcium supplement or give this iron supplement, to feed her, and then that will help her. but that's not always the right case. And because we know with the power of functional nutrition, that can be sometimes be lead to toxicity and other things, right? So giving supplements of that is not suggested at the moment, at this age itself. So getting, again, it's the mother who needs to get through milk as well, for because still, once the child weans off, still, major food of the child will be breast milk, right? So getting all the nutrients through that, the calcium and iron, and then
I have
adding.
to stop you there for a minute. So breastfeeding, if you're thinking that it should just be for 6 months exclusively, it
Yeah.
should be for 6 months. But ideally, it should be continued until your baby completes 1,000 days. Okay, that's the ideal time to breastfeed your baby. So I
Perfect.
just it just reoccurred
Yeah.
to me. So that is,
Perfect.
I'm so sorry to cut you off. You can
No
continue.
problem. Yeah. So, adding certain foods which are rich naturally in that will really, really help. So, for an example, if you're someone who can, who are okay with feeding your baby non-vegetarian foods, then liver is a great source of it. It will give you the iron which is needed to your baby. Egg yolks will really also help enhance the absorption of iron as well for food as well. And if you're a vegetarian or a vegan, then again getting it through A2 raw milk, curd, or yogurt, that will also help you to give enough calcium, enough iron. Though iron will be still deficient, but again you have to try your best, that make sure that the absorption and other things, everything, the gut health is doing perfectly fine. That will definitely help and stimulate the growth of the teeth itself, right? So yeah.
And usually these babies are also, most of the babies are also given these pacifiers, right? Which is
Yeah.
again not a very good option to to expose your baby with,
So
because
they are just a soothing mechanism, right? Which
exactly, it's just a soothing
at its
mechanism.
root,
Most of us,
right?
we
Uh,
fail to even take a note of the ingredient that the pacifier is made up of. It's sheer plastic,
right,
right?
right.
And that plastic can get infected, and there have been studies which have shown that there are increased chances of yeast infection in children
Hmm.
who have been introduced to these pacifiers. So there is a smooth transition to everything, and you need not introduce these foreign things to your baby just
And
to keep them.
even I think there is an addiction scenario to it as well, right? Because the more we give, we make them rely on pacifiers for soothing
Exactly.
mechanism, the more they will be addicted to it. And then every time when they are either cranky, or they want to play, or they want to do something, as a mechanism, they will either like hook on to pacifiers. And then I think it's an addiction pattern which is very hard to get rid of afterwards, right?
Yeah, and even talking about addiction, yeah, the addiction that's continued after they are introduced.
Exactly.
So it becomes really difficult to take them off these
Exactly.
pacifiers.
Yeah.
So like, be really careful while introducing them. I don't think it's a necessity. There are other ways to combat with
I
it.
think you can give food grade silicone that's still okay to some extent. If they feel like chewing, because in the teething period they will be having a lot of itching. They will be having a lot of irritation around their teeth. So they might hook onto something. Even your fingers itself. They would like to bite it, chew it, so that they
True.
can soothe their gums, especially. So you can give some food grade silicones. You can easily get on Amazon.
Yeah,
That's the other thing.
that's a good substitute. If you want, even if you
Yeah.
want to like introduce a pacifier, do not go for the plastic ones. A food grade silicone pacifier is available, and that would be a really good option. So I think most of the points we've covered. I would just want to know from you, from your experience, now that she's going to be one, uh, like, what were the tips that you like followed, and when you introduce new foods, and how did you do that? Can you
Yeah,
share your
so
experience here?
okay, so definitely I wouldn't have not been able to done at my alone risk if again Disha would not have not been there. The reason being, as I said, experience plays a lot of role and part in that. You can read in your books and theory to some extent, but when you introduce, what are the options you need to see. Sometimes out of the box, they might react in a different way, right? So you don't know that whether how they react. So the you need to start with the best and safest foods, right? So if like I'll share my experience, with all of you. So I introduced egg yolk to Nityasha in her early weaning days. I think 6.5 months, like I started introducing it. For few days, I think 10 to 15 days, she was having a tablespoon, or 1.5 tablespoon, with perfect, with no issues. But after that, she started to vomit or puke. Then what I did was, okay, like, to eliminate it. And then after a month of period,
Right.
I again reintroduced it
So
in
a
her,
wash off period basically.
yes, just to make sure that see that whether if it really makes any
Tolerate.
difference, or whether she's able to tolerate or not. So then I reintroduced it, but again she had a major vomiting episode, and like that was actually a freaking period. And it was I think evening or night time, so it was a little bit freaking period for us, because for half an hour it wasn't an issue with her, but after that half an hour she had a major vomiting episode, which, like,
Okay.
in which she whatever, after that, even after that we were feeding her, she was expelling, she was vomiting out everything, right? So that's where we learned that, okay, there might be some kind of intolerance issue for her towards egg, because egg yolks is the safest part from the egg itself. We didn't introduce egg white, because egg
Right.
white is a little bit on allergic side, right? That should be included after 1 year, right? So now I'll be introducing in her diet once she's completed 1 year, right? Just to
Right.
see whether she has developed that gut, so that she can tolerate, right?
So
But I
Suyash,
would, yeah.
one question here. So that was the only thing that you introduced while she was weaning along with breast milk, or anything else?
Yeah, after that, she, like, Nilisha, because she wanted substitutes, egg yolk wasn't shooting, so we included certain fruits. We included avocado, bananas, in her diet, right, just to make sure that she's eating. And then after some time, we also included bone broth, right? Then she also included lentil legumes like dals, and the sprouted dals which we have
Right.
soaked, fermented sprouted dals. And then we also added A2 raw yogurt, curd, right, which was perfectly, like, she used to love that, right? So it's not that she'll be reacting to all the other foods. There can be some more things, but most of the time you will get to know instantly, okay, whether the child like that or not, or whether that child has been able to easily tolerate or not. So the first sign is vomiting or puking. Second sign is any kind of rashes, any kind of weird behavior, any kind of unnecessary crying, which could
Right.
be because of
Okay.
any kind of digestive issue, like gas, bloating. Any kind of food might have created gas or bloating issue, right? Which
Right.
could be because of that as well. So those things. And then at the last, seeing her motions, his or her motions, right? How
Right.
well the stools are formed, what's the color of it, and whether
Consistency.
yeah, like, whether it's as she
Hard.
used to do it in nature, or not, right? Was it something different, unusual? So those are the cues, which I can leave you with. Rest is all your experience and what at the moment you're experiencing. So believe
Exactly.
me, I read that and I tried to be prepared for everything, but again, it will something instantly turn out different than your experience, yeah, than But again, it's a learning for you, so you'll evolve with each and every step. So, but it's an amazing stuff, right? As a parent, you learn a lot, as well as there are certain challenges, but yeah, there's always a growth with each and every moment, and each and every day. So
So
until
it's like
yeah.
truly said, you grow as the child grows,
Child
right?
post, exactly. So, but it's a beautiful experience, definitely. Of course, it's a painful, it's challenging sometimes, but yeah, it's worth all that. You enjoy that, you learn to see how human itself is, growing and developing, and how you used to do, even you live your own
Exactly. And what right nutrition can do for them for their good health ahead,
exactly,
right?
exactly. The
That,
way,
that
the way the child will able to achieve that milestones, right? You will feel amazing, right? The way the child's progressing. If everything you're doing, everything, like making her eat good stuff, doing all the things which we are asking you to do, definitely you see that the milestones are being achieved beforehand, even before the age.
exactly.
So that's a perfect sign of, I think, to
A
let the
good,
baby know how.
yeah, good nutrition as well as good health. Thank
Exactly.
you so much, Suyash. I really am becoming impatient now. I cannot like wait to see what how my grows and what good nutrition would how good
Yeah,
nutrition would help him.
and believe me, your partner's role also plays very, it's very very important, right? So as I said, I had all this information, but Nisha had all the practical information, right? With her mom's help, right? So I could have suggested, okay, Nisha, let chalo usko, like let her eat this, or let's make her feed this. But what's the outcome of this? That Nisha was able to beautifully, handle that, right, with cool,
Exactly.
calm, composed stuff. So of course, definitely your partner's role plays a very very important role there as well. So but it's a fruitful and fun journey, as I said. You both learn together, you have uh, like
Yes.
the evolution, right?
Teamwork.
And yeah, exactly. And in the last, I would just like to focus, because this age, 10 to 12 months now, which I'm realizing right now, this is a very very crucial period for bodies, so for babies immune system to develop, because
Oh,
in this 10 to 12 months period, baby will try to grab at anything and eat it anything and put it everything in her mouth, right? So our job as a parent, of course, should not be to restricting from everything, but to make her or his immune system as strong as possible, so that they can like tolerate all the germs and all the stuff, right? And even if your kid falls ill, it's fine. His or her immune system is developing, right? So it's nothing to worry. It's just we need to follow good nutrition, good practices which we already recommend, and most importantly, follow baby's intuition, baby's cues, right? If baby doesn't wants to eat, and if baby is refusing to get in the mouth, don't force it. Maybe try some other day, try some other thing, but don't try to force it, or don't try to make her look here or there, or play here or there, and put it
yeah,
in her
distract
mouth.
her, him or her, and
Exactly.
then
Make sure that you are in sync with your baby's intuition,
cues.
as well as, yeah, baby's cues as well, right? Because that's very important role there as
Yeah,
well.
that was again a very important
Your
point.
baby will tell, because recently, when Nitasha, like, that was been my experience again. She felt ill and she wasn't eating anything. She lost around 1.5 kg as well, because if you have fever, like, even we as humans, we don't like eat anything, right? Because our
Yeah,
taste buds
true.
change when there's a fever, cold, flu.
The
Your
appetite
appetite
itself goes
goes
down.
down. Exactly. And so all you have to do is make sure is that fluids should be taken care. If the baby is hydrated and drinking enough fluids, drinking mother's milk, drinking water, or whatever herbal teas which you make, if the baby is doing that, and if the baby is urinating well, that's fine, that's perfectly fine. Appetite will develop slowly once the disease, or once the flu fever has been taken care, once the body takes care of that disease itself. It will return, that's not an issue. But don't try to unnecessary force and be concerned that why my baby is not eating, why my baby's weight is going down, and all those stuff. That's fine, that's perfectly fine. Baby will develop, baby at her own. Just try to follow her cues, and her own natural instincts. That's very important. Oops, I think Ria's connection is slightly off. We'll just wait for her to come back. Yeah, so till the time she comes back, we'll just try, like, I'll just share my another experience. When she when your child is ill, especially in that crucial month, try to add a good probiotic for sure, because that will help develop good gut microbiome and immune system. And make sure you're getting zinc to your kid as well, and then making sure all the liquids and everything is going fine, and especially mother's diet, right? Because the breast milk itself will help to enhance the child's immune system. So that will really in turn help that. Yeah, I think she's back.
Okay, I'm so sorry. I just lost my internet there for a second. Yeah,
No problem.
you were saying something.
So yeah, like I said, that we need to focus on natural instincts of the baby, and make sure that we should not be forcing unnecessary stuff to
Yes.
the child, right? I think we can now take questions. There are some questions from our
Yeah.
viewers.
So someone is asking if
So,
mother's previous eating habits and lifestyle affect her newborn baby. Absolutely yes. That's again a very different topic for discussion. I won't even say a
yeah,
point, a topic in itself for discussion. Mother's habits, mother's eating, mother's lifestyle, everything during pregnancy is going to impact and affect the newborn's gut health and the overall health. So that is something I am planning to even discuss for the academy students who've joined in here. I am planning to discuss in this Thursday's case study discussion. Someone has
hmm.
suggested about pregnancy and pre-pregnancy, like before conception. What can you do and for a smooth pregnancy? So I am
So
thinking of
your
covering,
own case study,
yes,
right?
my
Yeah,
own
that's
case
actually
study
that's
and
perfect.
some additional help and points which
Uh, Keep in mind.
the people who are the women who are planning to conceive can take into consideration. So the answer for the question would be yes. Mother's health, mother's nutrition during pregnancy plays a very important role in the newborn's again life and health both. So I think that would be it for today. A lot of things discussed, and for some of you who have come here, who would come here looking for like very particular questions, like initially only I had mentioned that we are covering nutrition for newborns until the age of 1 year, right? Because after that again there are a lot of other things that come in, that would be a topic for discussion. So
Different topic. Yeah,
next time we can maybe again connect, and you can share your experiences. I would have my experiences until then
yeah, yeah,
to be
definitely.
there. Okay, so thank you so much, Suyash,
Always,
for sharing
always.
all
Pleasure.
the experiences and helping
Thank you
me
so much. Yeah.
personally. A lot of takeaways for me also, and of course for our audience here as well.
Always, always. Thank you so much, Ria,
Yes,
for bringing this topic, because it's a very important topic which everyone needs to know. There are
no
a lot of
doubt.
myths and misconceptions out there, so we'll try to debunk as much as we can
Yes,
on our
a lot
upcoming.
of micro topics also coming out of today's live, so we'll try and
Exactly.
address those also in future.
Cool.
All right.
Thank you.
So
Shalom.
yes. Bye
Okay.
bye.
Bye,
Thank
bye,
you.
guys. Thank you.